When trying to conceive with low progesterone, it's important to be aware of certain mistakes that can hinder your chances of becoming pregnant. Progesterone is a key hormone in preparing the uterine lining for early implantation and maintaining of early pregnancy. So these are some mistakes you should avoid. One, ignoring low progesterone symptoms. If you are experiencing signs like irregular menstrual cycle, short luteal phase, that is the period between ovulation and the start of your menstruation, spotting before periods and recurrent miscarriages, that can indicate low progesterone. So dismissing these symptoms as normal or unrelated to fertility can lead to delay in addressing the underlying issue and reducing your chances of getting pregnant. So if you're experiencing all these symptoms, it's better to be evaluated on time so that you won't have delays. Next one is delay medical evaluation. So, a delay in consulting your healthcare provider can prolong the time it takes to diagnose and treat your low progesterone. So, once you notice a sign of irregularity in your menstrual cycle, you should consult your doctor immediately. And waiting for too long before seeking medical advice can decrease your fertility window, especially if you are already aware of the potential symptoms. So, once you get a diagnosis, it's easier to treat it on time. So don't just sit down and ignore your symptoms. The next one is self-treating without professional guidance. Progesterone supplementation, if needed, should be done under medical supervision. Using over-the-counter progesterone creams, herbal remedies, or supplements without a doctor's advice can lead to improper dosage. Not timing your progesterone testing correctly, that's another mistake. Progesterone levels should be measured at specific time during your cycle, usually 7 days after your ovulation. That is when it is recommended for you to do this test. That is in your luteal phase, to get an accurate reading. Testing progesterone at the wrong time can result in misleading results, making it difficult to diagnose and treat this condition effectively. So it's better you do the testing at the right time. That's why your lab scientist will tell you to come at least 7 days after your period. Overlooking lifestyle factor. Why is this important? Stress, poor diet, lack of sleep, and excessive exercise can contribute to hormone imbalances leading to low progesterone. So, if you are trying to conceive and you ignore this sign, it can cause a delay in you getting pregnant. So when you fail to address these lifestyle factors, it can continue to suppress your progesterone levels, making it harder for you to conceive. So you should ensure that you monitor these lifestyle changes. Then ignoring underlying causes. Potential causes, conditions such as polycystic ovary syndrome or hypothyroidism or hypolactin levels can lead to low progesterone. So if you have one of these conditions like PCOS, hypothyroidism, it can lead to low progesterone. And not investigating and treating this underlying condition can prevent the progesterone levels from improving. Even if you are treating low progesterone and you have not addressed, maybe you have PCOS, it can prolong your fertility window, and this progesterone level will be hard to treat. Discontinuing treatment prematurely. If you are prescribed progesterone supplements, stopping it too early, maybe when you get a positive pregnancy test, can lead to a miscarriage. So it's often advised to take it in the early pregnancy to avoid a miscarriage. So the next thing you should avoid is not monitoring your progesterone levels during pregnancy. If you know that you have low progesterone issue, this can contribute to early pregnancy loss. So it's important you monitor your progesterone levels when pregnant. So failing to keep in track of your progesterone level during early pregnancy can result to undetected problems that could threaten the pregnancy. So it's important to monitor your progesterone level while pregnant if you have been having issues with low progesterone levels. The next mistake is assuming you can't conceive naturally. While low progesterone can be a barrier to conception, many women with this condition can still conceive naturally. It doesn't mean once you are diagnosed with low progesterone that you cannot conceive. Giving up on natural conception and relying on others is not good. Misunderstanding the role of progesterone is another mistake. Understanding how this progesterone works in your body and its role in reproductive system can help you make an informed decision. So the next mistake you need to avoid while trying to conceive with low progesterone is not addressing emotional and mental health. The emotional and mental stress of trying to conceive can impact your hormone level, including progesterone. So, neglecting your mental health and emotional health can exacerbate or increase hormonal imbalances, making it hard for you to get pregnant. By avoiding this mistake, you can better manage low progesterone and increase your chances of conceiving successfully. Working closely with your healthcare provider, maintaining a healthy lifestyle, and staying informed about your condition are very important steps in this journey. So, if this is your first time of seeing this speech, don't forget to subscribe, like, comment, and turn on your notification by clicking on the bell sign to know whenever we upload our videos. See you in my next video. Bye.